As we go on, let me call on our next speaker. He's a dear friend of mine. And for most, kilala niyo tong taong to. He's such a person who really had a big heart. Not only in ministry, in churches, but to really have a ministry outside of church. This is a kind of a man, a pastor and a friend na talagang yung puso niya, he always, even in our church, so he's a pastor in our church sa BCI, he always encourages and pushes us to not just look inside church, but also to look outside of church, because the greater world and ministry awaits us outside church doors, which is timely kasi nangyayari na. Okay, without further ado, let me just introduce to us our next speaker, Pastor Ruben Hernani Jr. Okay, he's from BCI, also the Mindanao Director and part of the National Directorship of OneChild. Pastor June?
Yes, thank you, Pastor Mel. Maraming salamat po sa lahat ng nandito, mga participants. You encourage us with your testimony and testimonies. Thank you for the panelists. No? I hope that what we are doing today will help us to move forward na may confidence tayo that God is moving and we are participating in what God is doing. So my part is to present to you the response of faith-based NGOs, yung mga non-government organization faith-based, to the ongoing pandemic in partnership with faith communities. So when I say faith communities, yung mga simbahan, a short introduction of where I am today, itong OneChild. OneChild is started in India in 1954 sa Calcutta, where Mother Teresa ministered to the mga lepers, no? Calcutta, India. So that's where OneChild started in 1954. Matagal na po. And today it is present in 14 countries with almost 40,000 sponsored children. And ito po yung OneChild. It's a faith-based NGO. If you also heard about Compassion International, it's also a faith-based NGO. Present in a lot of countries. And World Vision, you know World Vision, it's also a faith-based NGO. Tear Fund, Child Fund, Children's Fund, Save the Children. There are a lot of faith-based NGOs, non-government organization, helping now together with the church, the faith communities, address poverty alleviation. Yung mga hard-hit na mga cities, municipalities. And what is unique with OneChild is that we are into slums, tribal communities. To name a few, we have partners in Arakan, yung mga tinananon, with FFCI, Pastor Ives Magdamo, Architect Ives. We also have partnership in Malungon with Blaan, with the CCT, Community of Center for Community Transformation, with Ma'am Ruth Calyanta. So we also have Visions of Hope, Malungon at Palawan. Mga Palawanon. We also have partnership with Foursquare sa itong Davao de Oro before Combal, which is now, which are the Mansaka tribe. We are opening a partnership in the midst of pandemic, mga kaibigan, pastors, friends. We are opening a partnership in Aklan with tribal and indigenous peoples org in Aklan. So lahat po sila nagkumpol-kumpol. TIPO is an organization of tribal and indigenous people in Aklan. We will hopefully register 172 different tribes in Aklan by November 8. And in the midst of pandemic, this is a miracle. That's the only one approved in 14 countries because OneChild is present in 14 countries with almost 40,000 children. And so ito po yung experience namin as a faith-based NGO. Sacred Harvest, like Pastor Joel Pranza, Kuyoweng, is also a faith-based, but they are in equipping, no? Mindanao Equipping Program. Marami pong mga OneChild, like sa Digos, OneChild na mga partner namin, ng mga churches na partner din ng Mindanao Equipping Program. So we are collaborating and working together. So ito po yung, just to show you the background, ito po yung nangyari in the past 7 months. I'd like to share my slides. So the root cause and implication is the pandemic. Ito po, di ba? And then lockdown came in March 16. Then because of the long quarantine and lockdown, economic downturn, nag-result, recession, and then we lost a lot of opportunities, walang mga conference, walang in-presence na mga activities, the churches closed. In our local church, sa Beraca Community International, nag-dip ng 20% yung offering last April. Imagine ganon, 80% we lost tithes and pledges and offering. Lahat ng daming opportunities to minister, but napalitan din yun. Derailment of plans and routines, di ba? Parang yung trend na derail. Wala, yung plano natin hindi natuloy, ganon, mga travels dito sa inside the Mindanao or outside the country, the Philippines, talagang na-derail yung plano natin, mga routine, because we were locked down 3 months. Rise of mental illness, this is reality. And this is also happening sa mga poorest of the poor. The hardest hit sa COVID-19 ay ang mga mahihirap po, kaibigan. So yung mga nasa depressing situation, they are the hardest hit, and they are also experiencing depression and mental illness. So ito po yung result sa economic situation. It is hitting particularly hard the Americas, no? Doon sa North America. A lot of jobs lost according to the report. Ito po, overall, the Americas lost over 18% of working hours during the second quarter. Ang equivalent po, this is very recent, just last week, according to International Labor Organization, 70 million full-time jobs were lost in Americas, particularly in the USA. And OneChild funding and even Compassion, World Vision, majority of the fund of the NGO comes from Americas. Ito po. Of course, other countries are contributing. But OneChild, our organization, isa lang po yung pinanggagalingan ng fund, sponsorship fund. It's from America, USA. So we are hardly hit sa funding. South America has shed a full of 20.6%. That means 15.3% they lost jobs. Sa Europe, sa Arab, and dito sa Asia, 13% and 12% sa Africa. Ito po yung lost unemployment because of the COVID-19. Sa Philippines, let's go closer. Philippine economy plunged by much more than expected in the second quarter. April, May, June, falling into recession for the first time in 29 years. Brothers and sisters, economically, we are in recession. Nasa economic depression po tayo, as economic activity was hampered by one of the world's longest and strictest coronavirus lockdown. Sa Southeast Asia, economy shrunk by 16.5% in April to June, particularly sa Philippines. Ang positive lang sa gross domestic product, GDP is the total of the services and products produced by a country. Ang positive lang po ngayon ay ang China. Lahat po negative ang gross domestic product. We are in depression. In the first 29 years, no? In the last 29 years, nag-dip ng 16.5%. That means from zero, nasa baba tayo, negative 16. Yun yung economy natin sa Pilipinas ngayon. So the challenge is this. Because of the COVID-19, we thank the panelists from Bishop Pantoja. No? Thank you so much for giving us the perspective. Ito po yung challenge. And thank you for the rest of the panelists. I'm the last one. So ito po yung nakikita natin. People are closer to the Lord because we draw to God in prayer. Ito po. We are now more prayerful. And then we have public health, mga restrictions, yung mga regulations, and a vaccine is coming up. A lot of vaccines actually, 120, at least 120 on the line na parang tinetest nila na magiging vaccine for against COVID-19, coronavirus. For your information, coronavirus has been here since 1960 po. 1960 pa. It's a family of virus. Pero COVID-19 ay pinakabagong strain. So it's coronavirus infectious disease 2019. Pero it has been here since 1960 po. So it's nothing yung strain. And so they're working on to really protect the people, kaya nga public health. Nung una, 911, ang concern ng United Nations is terrorism. Ngayon po, yung bagong concern ng United Nations, World Health Organization particularly, is public health to protect us from the virus. And then the church is starting to connect to the home. Ang ganda po nang nangyari since lockdown. And even we observe it as a faith-based NGO working with the churches, faith communities. Ang mga pamilya po nag-worship as mentioned by Pastor Yuland, no? Badoy and other speakers. Ang dami pong mga simbahan na naging mga tahanan na naging simbahan. The churches has become extension of hope centers. What we call it hope centers, yung mga nasa simbahan where the registered children go and avail of the program, Holistic Child Development. Ngayon, dahil nag-lockdown, close yung mga simbahan, yung hope centers, dinala doon sa mga bahay. That's something good. And then yung bayanihan spirit, lumabas. Ito, we are collaborating, as mentioned. And the youth engagement has increased. And the youth now are ministering to each other. We call this peer counseling. And they're doing something to disciple, to evangelize. Ito po yung mga lots of opportunities because of the pandemic. One person said, crisis is a dangerous opportunity. There is danger, but we have a lot of opportunity as the people of God, as followers of Jesus. So let me give you the impact to children and their families according to the rapid assessment of World Vision. I'd like to send to you these materials kasi makakatulong po sa atin. Itong assessment na ginawa ng World Vision, May 6 to June 6 po nangyari. So kasagsagan ng lockdown, di ba? March, April, May, ito, kasagsagan. Respondents, they assessed 985 individuals from 42 municipalities, 6 na cities, no? Different cities from 20 provinces. So this is a sample, a very broad sample they collected from the very poorest of the poor by World Vision. Ito po yung impact to children and their families. The topmost critical problem sa mga mahihirap po. This includes churches na nasa poor communities. Food security, ang priority po ng Pinoy, no? In the Philippine context. They always look forward to having 3 meals a day. 51%. Sabi nila, food security talaga. Ang pangalawa po is educational opportunities. Opportunities to send the children to public school, formal school. Yun yung mga heart ng mga kababayan natin. Even the poorest of the poor, no? The tribes, those who are in the slum. I forgot to mention, in Matina, Aplaya, Ipil Beach, we have registered children na mga Bajaw. We are working with Vineyard, sila Cha Gambe, si Gediel and Cha Gambe. Nasa 23C, yung palaging lockdown dito. We have registered children na Bajaw. And they want their children to be educated. Pangatlo po na priority, according to the rapid assessment, ang result, access to healthcare. 24% nagsabi na they really want to have access to good healthcare facilities and services. So, ito po yung hardest hit, ang poor communities. That's why the rapid assessment na ginawa ng World Vision, sabi nila, ang recommendation nila, may nag-share kanina, no, si Pastor dun sa DCMF, sabi niya, itong food security, importante. But food is affected because of the loss of job. Ang daming mga kababayan natin na nasa below poverty line, na one day work and makakain sila. Diba? Yung day wage. They are working for a day para makakain bukas. Parang ganon. So, livelihood is top one. Number one talaga, invest on income-generating livelihood and enterprise. Churches, let me tell you, mga pastors, no, I'm speaking to myself. Let's help our mga kababayan kasama sa simbahan or even our neighbors to be entrepreneur. Ang daming mga businesses lumabas ngayon. Yung gardening, ang daming nag-benefit kasi binibenta yung tanim, mga bulaklak or yung pots, di ba? yung mga homemade pots. You teach your members sa simbahan how to do something na even cooking, baking, kung may ano sila, may paraan sila to bake. Yung plumbing, electrical services, yun pa rin yung mga malalakas ngayon. So let's help our membership, our neighborhood have that income generating na mga livelihood. Even in times of pandemic, ito pa rin yung kailangan. Food security, pangalawa, to support and to really make the family stand strong, no, in the midst of physical threat, yung COVID-19. Dapat yung immune system mataas because immune system is God's gift. Parang soldier sila na mag-guard sa body natin. And thirdly, education. Assist families in ensuring children are in school. We are so glad yung mga poorest of the poor, registered children ng OneChild, mataas pa rin yung enrollment. Nasa more than 80%, close to 90% nag-enroll sila. Sabi namin, hindi makahinder itong COVID-19. We can do something. Let's talk about how you go online kahit wala kayong laptop. Ang mga poor nga, wala silang internet connection. But the Hope Centers, yung mga partner namin ng mga simbahan, they're looking for ways to make the church as a learning resource center. Ginagawa nila yung simbahan na parang tutorial. They will call the poor parents, come here, we will guide you, we will invite a teacher para turuan kayo. And then when you go home, may modular mga printed materials, you can assist your child in learning. So innovative ways so that education will continue. Yan po yung mga ginagawa ng mga faith communities na partner ng mga NGO. May collateral damage po, nakakalungkot. OneChild Philippines lost one Hope Center director, yung partner church namin. She is also a pastor's wife. Just last month, exactly a month ago, from Reformed churches in the Philippines. Ito po, namatay siya dahil sa COVID. And just today, while we are ongoing sa symposium, one registered child in Metro Manila died. We are checking if COVID talaga related. But he was healthy. Nakita ko yun. Masaya yun. We call him as a registered child. Elijah pangalan niya. We call him Little Pastor. Pero pumanaw na po siya. He died just today, early today. Very sad. So ito po yung mga alternative plan during disaster na ginawa ng mga simbahan. The Hope Centers or the partner church namin ay nag-distribute ng food packs. I think I heard also Compassion. I worked with Compassion 5 years. They also distributed mga relief goods. So yung mga development, community development or transformational development org, nag-shift sila sa relief distribution. Food packs, hygienic kits, medicines, income potential were directly affected. Diba? Na-stop ang work. So ito yung ginawa. Talagang mga ilang beses na nag-ano kami, yung relief goods binibigay ng mga Hope Centers sa Digos, sa Davao, sa Palawan, sa Metro Manila, sa Cebu. We have 12 partners in Cebu, Daan Bantayan, sa Sapangdako, sa City. So we encourage them na itong sponsorship fund, gamitin nila, they budget it so that the family can eat. And they will also have alcohol, sabon, shampoo, and all hygienic kits that they need. Churches turn to social media platform, mga short message sending, yung texting, and phone calls to increase health awareness. So kami, health awareness drive. So we encourage the 32 partners of OneChild Philippines, 32 lang po yung simbahan na partner namin. We encourage them to have info drive so that they will conquer the perceived fear. Ang takot kasi mataas kung hindi informed. And so we appreciated one partner, ginawang comics po sa mga bata para ma-inform sila sa itong kung ano ang COVID-19 and how to make themselves safe. Ginawang comics, we have the material. And ito po, center-based activities are now home-based. As I said, yung nasirado yung simbahan, so ang ginawa ng mga kasama na mga simbahan, doon na ginawa ang activity, holistic child development, mga activities, doon na sa bahay. So naging extension, Hope Center, Learning Center, ang mga bahay. Now, the parents and the guardians, they took the primary lead in implementing the lessons. Of course, with assistance sa mga teachers ng Hope Center, yung partner church. But we saw the increase of engagement of parents. Yung mga badyaw, I tell you, yung mga badyaw po, nagbabersikulo na. They are already reciting verses. They're worshiping God in their homes. Kasi may cellphone sila eh. May smartphone yung mga badyaw. Nakakatuwa po yung nangyari. Some Hope Centers, yung partner church namin, gave out food packs, vitamins pa, no? May nagbibigay ng vitamins to families and Bible study materials. Nag-memory verse. A few coordinated with barangay health workers and nurses to monitor the health of registered children, including their families. So, nakikipag-work sila sa BHW and local nurses po. And we are encouraging them for local resource mobilization. And very creative yung ibang Hope Center, yung mga simbahan on the ground, because they assigned parent leaders dito na community. Lockdown kayo, but you can mobilize your own parents there para ma-distribute itong food packs. Ganon sila. May rise ng initiative ng leadership sa community. Yung mismong registered children and their family, nagiging leader po sa panahon ng pandemic. House visitation by the staff were done only during emergencies. So we also encourage the Hope Center staff, yung mga volunteer ng simbahan na partner ng OneChild, to wear mask, yung mga shield, and they don't have to go to the community kung hindi emergency. Emergency cases only. And ito po yung gamit sa sponsorship fund. These are the monthly fund na binibigay doon sa mga church partner ng OneChild or whatever NGO, no? Since activities were halted and are now home-based, Hope Center leaders decided to use the funds for food packs, hygiene, medicine, vitamins, and other emergency needs. This is done taking into account global office instructions and communication. So this is internal. So we were instructed to redirect fund to purchase food items, collaborate with government and NGOs. We encourage collaboration in the community because the funding po is limited. Hindi naman malaki yung funding. So we encourage the community na they partner with the local government. Diba? May tulong sa DSWD. Nakatanggap rin kayo yung tulong po. So we encourage the poorest of the poor, yung mga registered children and their family, to collaborate with NGOs, other NGOs. So ito po yung learning. Let me show you the learning according to the response of the church partners namin. Ito po, availability of learning materials in different forms, such as online. Pwede palang maka-learn online. Audio and video recording. Yung mga simbahan po started to record and mga video or audio recording, and then they sent it to through Facebook or through Gmail or email, yung mga recorded, so that learning can continue sa bahay po. And then they created worksheets. Before the Department of Education issued the modality, no, yung modular distance learning, before they issued that, yung mga partner na mga simbahan, partner of OneChild, Compassion, World Vision, iba pa, may mga home-based worksheets na sila, no? About the Bible, about how to conquer fear and increase your faith, about loving one's family and being involved in the neighborhood. Ang dami pong lessons through worksheets, yung printed material. Pangalawa pong lesson and learning, heightened engagement of caregivers. When we say caregivers, yung parents, yung guardians ng mga registered children, they took the responsibility to teach their children. Nung una po, pinapadala lang nila sa center. Okay, turuan nyo yung mga anak namin. Parang Sunday school, no? The family, the parents will say, you go to the church for Sunday school. You can learn something from your teacher, Sunday school teacher. Ngayon, yung parents na inako yung pagturo sa mga anak. And this is something good. Their engagement heightened. And third po, capability of child champions. Child champions are the volunteers in the churches. Child champion yung tawag namin. And caregivers or parents, guardians, in disaster response and child protection. You know, ang OSEC po is number 1 yung Philippines. Online sexual exploitation of children. Nag-rise ng 300% during pandemic lockdown. And International Justice Mission reported nag-increase siya ng 300%. And ang epicenter ay ang Pilipinas. But we are engaged with the child champions and caregivers to always protect the children during lockdown. No verbal abuse, no physical abuse, no sexual abuse. We always remind each other of child protection as one of the priorities. And disaster response. So ito po yung mga lumabas na learning. Now, we need to be ready kasi ang Pilipinas, prone sa disaster. As a church, as a family, as a community, kailangan disaster responsive and resilient. Ito po yung learning. And ito, nakita po namin yung importance of livelihood program for the parents to ensure food security amidst crisis. Local resource mobilization, like-minded NGOs, LGUs, agencies working together to address the local needs. So na-mobilize yung mga resources galing sa government, mga non-government organization at mga local government, mga NGOs. And then the necessity of regular intercession and devotion. You know what kept us sane? Yung talagang hindi tayo masiraan sa utak, yung palaging Bible study, prayer together online. This is what kept us strong actually. We minister to each other, yung kumusta ka na? Kahit online, hindi siya face to face. But it supported us. It supported the staff, child champions, yung mga volunteers, the children and their families. So, pinaigtingan po yung intercessory prayer and devotion. Study ng Bible weekly. In fact, sa observation namin, twice a week, merong Bible study, merong prayer time. Iba pa yung Sunday worship, yung online. So, 3 times po. And this kept us strong in our mental capacity. It made us aware of the dangers of depression. And yung word ni God, yung prayer, yung kumustahan po, it helped us boost our morale and our emotion. So kahit sa Christian community, we need this. We need this po. So ito yung focus and priority namin as an organization with in partnership with the churches. Family engagement, moving forward. Family engagement for discipleship and community involvement. Tuloy-tuloy na po yung yung pag-move nito. The inertia has been broken. Nag-andar na siya, parang sa bike, ang matigas lang yung umpisang pedal mo. Pag umandar na yan, tuloy-tuloy na. Primera, segunda, tercera. So we are looking at strengthening family engagement. Yung parents taking the lead to disciple their children. Whether Badjao, Mansaka, Blaan, Tinananon, Palawanon, lahat ng mga tao yung nasa slums, even poorest of the poor, my friends, brothers and sisters, pastors, ministers, they can do it. They can disciple their children. So we are looking into strengthening the engagement of the entire family and to involve them in the community. They will not just be concerned of their own benefit, but they will think of other people in the community po, involvement. So that's the first priority and focus. Second po is collaboration. Itutuloy yung collaborative spirit of like-minded people. Bayanihan spirit na umpisahan na. Let's continue partnering. Ito po yung prayer ni Jesus sa John 17, that they may all be one. So nandito na tayo mga churches. Let's lower yung mga walls natin and reach each other's hands and work together. Ito po yung kagandahan ngayon kasi na-break yung mga wall. Yung wall sinira ni Lord para we can hold each other's hands and move together to expand the kingdom of God. Pangatlo po is youth active participation. We see the rise of youth taking part. Yung campus ministry sa JDM, sa YWAM, ni-report kanina, and other IVCF, Campus Crusade, Agape, Navigators, ang daming youth po nag-rise to minister to each other. They became counselors to each other po. Ang peer counseling to us. And we are thankful for the youth. Kahit sa mga mahihirap, they are ministering to each other. Fourth and last, but this is not the least, capacity building. Nakita po natin na kailangan tayong mag-upgrade. Upskilling, learning new skill. Itong Zoom, itong online conference, webinar, whatever you call it, we adapted to it, di ba, mga Pilipino? You know, Facebook is number 1 social media. Mga 2 billion po ang naka-hook sa Facebook. And we are using it to evangelize. We are using the social media to counsel. We are using the social media platform applications for our online worship kasi ang dami pang nako-close. So we need to upskill, meaning learn new skill. Huwag niyo sabihin na, ay senior na ako, parang late na. Hindi. Si Pastor Dave po, Magalong, pinakamagaling sa amin sa technology. Sa edad niyang senior, very siya, up to date sa technology. So ito po yung plano ng PLDF, maybe next month, yung upskilling, no? How we learn to do video editing, Zoom, yung mga ganon related so that we can further advance the ministry. So ito po, upscaling. Upscaling is to improve the quality. We will not just learn new skill, but we will have quality like video taking. Ano ang right video taking? So we are calling yung mga tech dito, no? Yung mga galing sa video editing, we are calling you mga multimedia masters. We are calling you to contact Pastor Alvin. So because we need your expertise so that we can assist other churches po, mga pastors, mga organizations na medyo challenge sila when it comes to technology. So yun po yung mga focus and priorities ng mga faith-based NGO in partnership with the churches. Maraming salamat po.